constipation, fatigue, temperature regulation issues, depression, weight gain? Are the symptoms you're experiencing caused by menopause or perimenopause? Or maybe there's another root problem underneath your symptoms. Maybe there are actually two completely different root problems, both of which are conspiring to make your life miserable. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those resources are about hormones and hormone optimization with a special emphasis on menopause. In this video, we're going to talk about two different sets of seemingly unrelated hormones, along with the symptoms that you might experience when you start losing either of those sets of hormones. Unfortunately, when you get into your late 40s or early 50s, women frequently experience a lot of disturbing symptoms. Those symptoms might be perimenopause or signs that menopause is coming up pretty soon in the next few years. Here's a list of several symptoms of either perimenopause or menopause. See if you can recognize any of the ones that you've struggled with in the last few years. Hot flashes, night sweats, or what are called cold flashes, vaginal dryness, emotional changes, irritability, mood swings, depression, dry skin, dry eyes, dry mouth, periods that are heavier or lighter than usual, joint and muscle aches and pains, changes in libido or sex drive, difficulty concentrating or memory lapses, sometimes called brain fog, weight gain, hair loss or thinning hair, constipation. Well, you may not have given any thought to this, but low thyroid hormone levels also frequently affect women starting in their 40s or 50s, exactly the same time when you start moving into perimenopause and menopause. And here are some of the classic symptoms of low thyroid, and see if any of these sound familiar. Feeling tired, fatigue, constipation, weight gain, soreness throughout your body, including muscle weakness, depression, being unable to tolerate cold temperatures, dry, coarse skin and hair, hair loss or thinning hair, experiencing a decrease in sexual desire, frequent heavy menstrual periods, feeling more forgetful, also known as brain fog. Well, there's an astounding overlap between the symptoms of menopause and the symptoms of low thyroid. The majority of these symptoms might be caused by two different hormone deficiencies and just happen to start around the same time. Menopause is all about the loss of estradiol, progesterone, testosterone, and some other hormones. The loss of hormones at menopause is really the root problem that's underneath the well-known symptoms like hot flashes, night sweats, insomnia, and mood swings. But the loss of hormones at menopause also leads to some lesser-known symptoms like weight gain, depression, constipation, brain fog, thinning hair, and low sex drive. These are exactly the same symptoms that you can see in women or in men who have low thyroid hormones. You understand there's a double hormone deficiency going on here. You're low on estradiol and progesterone because of perimenopause or menopause, but your thyroid hormones are also low at the same time. So what's the solution? The most effective way to deal with all of these symptoms, all of them, is to treat both hormone deficiencies. Now, to be clear, not every woman going into menopause also has low thyroid hormones, but a pretty large percentage of women going into menopause do have issues with their thyroid. The key is to have all your hormones checked by a hormone optimization specialist. That's somebody who understands all the nuances of both menopause and low thyroid, which is often referred to as subclinical hypothyroidism. The first step for a provider to get started, getting you some relief from your symptoms, is to start testing your hormone levels. Testing hormones is going to vary from one provider to another, and also from one stage of life to another. And here's what I'm talking about. Let's talk about perimenopause testing. In perimenopause, your levels of the two main sex hormones that we talked about, estradiol and progesterone, are likely to be all over the place. Estradiol, especially, can be very high one day and very, very low the next. Progesterone is likely to be low overall, but can also have some major fluctuations, maybe not quite as dramatic as estradiol. Because of the unpredictability of hormones in perimenopause, a lot of providers choose not to really test them. They figure that any level that shows up on a test today isn't going to be that useful since it's going to be something way different tomorrow or the next day. So many, but not all, hormone providers simply don't do a lot of hormone testing for women in perimenopause. It's not necessarily right or wrong to test or not test during perimenopause. The choice usually comes out of a provider's specific training and their personal experience in testing patients and finding out whether it was useful or not. If you're in menopause and you haven't had a menstrual period for over a year, your levels of estradiol and progesterone are very likely to be zero. For that reason, many providers simply choose not to test estradiol and progesterone levels in menopausal women, at least not initially. They can pretty much guess that your levels are nothing. Providers might look at biomarkers other than estradiol, though, and progesterone. For example, they might want to take a look at something called follicle stimulating hormone, or FSH. A high FSH level is one indicator that your system is asking for more estradiol and progesterone. It also sort of gives some pretty loud hints that you're in menopause, not by itself, but along with the loss of menstrual periods. Now, with thyroid, most providers will agree that testing your levels is almost always a good idea. A hormone optimization provider who knows what they're doing will want to test several different levels to find out how your thyroid is doing. Examples of these would be liothyronine, which is a thyroid hormone called T3, levothyroxine, that's another thyroid hormone called T4, and even better than T3 and T4 is something called free thyroid hormones. That's a measurement of the thyroid hormones that are actually available to your system. So free T3 and free T4 are ones that will be tested, as well as thyroid stimulating hormone, or TSH, and thyroid antibodies. There are some other thyroid tests that go into more depth that some providers will add, which is great, but those are kind of the basics of the thyroid testing. After you've been tested or not, your provider is going to want to look at treating you. The goal, seems pretty obvious to most of us, is primarily to reduce or maybe even eliminate as many of your symptoms as we can. Now remember, we're hoping to eliminate your symptoms no matter which of those hormone deficiencies is the root problem that caused those symptoms in the first place. There's also sort of a secondary goal beyond reducing symptoms, but I'll talk about that one in just a minute. The treatment for menopause involves replacing the hormones that your ovaries no longer make with the exact same hormones that your ovaries used to make, namely estradiol and progesterone. Replacing estradiol helps with several menopause symptoms, things like hot flashes and night sweats, irritability and mood swings, weight gain, depression. Replacing progesterone helps with a different set of symptoms. Sometimes those symptoms overlap with the symptoms that estradiol affects. Progesterone helps with insomnia, anxiety, depression again, bleeding issues, breast tenderness, which can also be caused by estradiol. Side note about perimenopause, because perimenopause is a time of those big hormone fluctuations way up and way down that I mentioned, some providers will replace the missing progesterone because that usually doesn't cause as many problems, but they may be a bit hesitant to give additional estradiol. Replacing thyroid hormones goes a long way toward relieving those symptoms of low thyroid that we talked about. Most hormone optimization providers will replace both the T3 and the T4. That double thyroid replacement isn't such a popular idea among a lot of providers who believe that just T4 is perfectly fine and that patients don't really need extra T3. Well, theoretically, T4 is supposed to be converted in the body into T3, so most people don't need to add T3 theoretically. The practical reality is that a lot of people don't have the enzyme, the biochemical machinery that converts T4 to T3. So those people may have plenty of T4 on board, but they still feel terrible. That's why it's a good idea for your provider to treat you with both T4 and T3, depending on what your lab results show. And then there's the idea of retesting. Once your provider has started prescribing whatever hormones to try and optimize your levels, they'll want to do some retesting to see where you landed. In both menopause and hypothyroid, this testing and retesting can take a little bit of time. You might be able to get a retest after a few weeks. Sometimes with thyroid, it might be a bit longer, maybe as long as 8 weeks. The idea here is to keep retesting until we find the dose that has 2 ultimate results. First of all, your hormone levels are in the high normal, or sometimes called the optimal range. And second, you're feeling better. Most of the symptoms are either greatly reduced or they're completely gone. This process of testing, treating, and retesting, whether with menopause or thyroid, is where the art of medicine comes in. A hormone provider with experience and training knows exactly what to do when things don't work out really the way you expect them to. It's that training and experience that gives the hormone specialist sort of an advantage over a primary care physician or an OBGYN who doesn't really have that kind of experience and training. The good news is that both thyroid symptoms and menopause symptoms can really be relieved or, as I mentioned, even eliminated by getting your hormones, estradiol, progesterone, T3, T4, and others, optimized. Even better news is that by optimizing both your thyroid hormones and the hormones leading to menopause, those can actually go beyond eliminating your symptoms and reduce your long-term health risks at the same time. Maybe you've heard that hormones are risky. Maybe you're just not sure about the whole idea that HRT reduces your long-term health risks. Well, if you're in menopause and you're unsure about this whole HRT idea, whether it's the right thing for you and your menopause, I'm here to help. I've created a digital course that I call the Menopause Solution. This course helps you make your own HRT decision. The course uses easy to understand, bite-sized videos to help you answer one simple question. That question is this: is hormone replacement therapy, or HRT, right for my menopause or not? Together, you and I can help you answer that question in about 2 hours. For a limited time, I'm also including access to another course, Thyroid, It's That Simple. In the past, this course has only been available through hormone providers who subscribed to my patient education programs and gave it out to their patients for free. For a limited time, though, I'm offering the thyroid course directly to you as a bonus to my Menopause Solution course. It takes about 30 minutes to go through the short, clear, simple videos in the thyroid course. Thyroid, It's That Simple gives you an in-depth understanding of what thyroid deficiency looks like and how your provider can test and treat it. And it's included at no additional charge when you purchase the Menopause Solution. To learn more and take advantage of the Menopause Solution course, along with the Thyroid bonus course, click the link on this video that says Make Your HRT Decision. If you liked this video, click the like and subscribe buttons. That helps me a lot with my channel. You can also ding the little bell to get notified anytime I post a new video. Hey, thanks so much for watching. I look forward to reading your comments in the comment section and talking to you again real soon.